Hello dear friends, this is Dr. Shailesh Sable and I am a liver transplant surgeon at Apollo Hospitals, Navi, Mumbai. Today on the occasion of World Liver Day, I would like to invite you or welcome you for this small health chat. So as you all know, every year on 19th April, we celebrate World Liver Day in order to raise awareness about liver diseases or liver illnesses. Now, let us see how your liver works and then we will quickly discuss about some of the common diseases that affect your liver which we see in our day-to-day practices. And then in the end, I would like to share some tips to keep your liver healthy. So how does your liver work? Liver acts like a factory which runs 24 hours a day without a break. Liver weighs around 1 to 1.5 kilogram and it is situated in the right side upper part of your abdomen. Now, how does your liver function? It acts like a large industrial unit which simultaneously works like a manufacturing hub, a storage house, and a processing unit. Liver receives dual blood supply from hepatic artery and portal vein. The artery supplies oxygenated blood to help liver function efficiently, whereas the portal vein supplies the intestinal blood, which is rich in nutrients, both macro and micro. Now, once the nutrient-rich blood is reached to the hepatocytes or the liver, it is further taken up by the multiple small lobules, which is small subunits of liver. They help in processing of this uh, nutrients. Now, let us say, for example, carbohydrates. Carbohydrates are taken up by the liver and they are further broken down into tiny sugars, which is then used by the body and other organs as a source of energy. Not everything which is supplied by the liver is used by the body. Some of that is left over, which is packaged in small envelopes and is kept in the liver for later use. We call it glycogen. Now, everything that comes to liver is not good for the liver. For example, some of the toxins or toxic substances, metabolic waste products, and bacteria. Liver continuously monitors this substance and helps to clear this from your body to keep your body infection free or toxin free. Now, it either removes it through kidney or through intestine. Liver also works like a manufacturing unit or a manufacturing hub for various plasma proteins, which acts as a carrier protein or a transportation protein. It also manufactures blood clotting factors, which helps in sealing blood vessels and acts as a coagulation mechanism. Liver also produces cholesterol from fat, which is later converted to hormones and used by the body. As a metabolic byproduct, liver produces a liquid called as bile, which is greenish and bitter tasting liquid. Once it is found by the hepatocyte, it is funneled into the gallbladder and it's stored there. And at various intervals, it is thrown into intestine. Here in intestine, it destroys the bacteria, it degrades the fat, and it helps neutralizing the gastric acidity. So, as you all have seen, liver is a very vital organ and it works efficiently throughout the day without any break. It is our duty to keep our liver healthy. So now let us have a look at some of the common liver diseases which we see in our day-to-day practices and which are completely preventable. Let us start with fatty liver disease. Fatty liver disease is nothing but accumulation of fat in the liver. This happens whenever there is an extra source of calories to your body. This fat causes inflammation to your hepatocyte and ultimately leads to scarring and inflammation, and in the end it causes cirrhosis, which is the end stage liver disease. Now this is completely preventable by balanced diet and exercise. Next in line is alcohol, which is a direct toxin to the hepatocyte, and again it acts like this. The mechanism is similar. It basically causes inflammation, scarring, and in the end cirrhosis. Now, there are certain viruses which affect your liver. For example, hepatitis A, B, C, D, and E. Of these, hepatitis A and B is completely preventable by vaccines, whereas hepatitis C, D, and E can be prevented by following safe sexual practices, avoiding needle sticks, or using disposable needles and syringes, and consuming healthy and hygienic diet and clean drinking water. As these diseases are spread by bloodstream or fecal route. Now, in the end, a word about liver cancer. 80 to 90% of the liver cancers occur on the background of liver cirrhosis, which means they are completely preventable. However, for those who already have cirrhosis, it still can be managed efficiently by diagnosing it early through screening and by continuing treatment for the primary liver disease. So, dear friends, lastly, I would like to share some simple tips to keep your liver healthy. So the most important and the foremost is balanced diet, which means green leaf vegetables, fresh fruits, cereals, and pulses. They provide fibers and antioxidants to your body, which keeps your liver healthy. Exercise daily or a routine exercise daily for 30 minutes or alternate day for 45 minutes also keeps your liver healthy. Now, there are certain substances which we need to avoid, for example, smoking tobacco or alcohol, excessive sugars, and salt. Apart from this, there are certain substances or foods which are helpful for liver, for example, coffee, green leaf vegetables, almonds, and olive oil. With this, I would like to end our session here and I'm happy to answer any queries in the comment box.